Women age, the levels of certain hormones decrease, which can cause some side effects. Some women try to battle these symptoms by replacing hormones. However, the addition of hormones can also drive cancer to grow and spread. Cancer treatments like hormone therapy sometimes aim at blocking these hormones. Doctors Sayee Kiran and Hardas are with us here in studio to explain more. Thank you both for being with us this afternoon.
Thank you for having us.
I want to start. Can you explain what hormone replacement therapy is and why some women choose this type of treatment?
So hormone replacement therapy usually consists of two hormones, estrogen and progesterone. Now, if a woman had had a hysterectomy, then she just need an estrogen replacement. But if the uterus is still there, then you are going to need estrogen and a progesterone replacement. Sometimes if there's a low level of testosterone, then you will add that too.
Are there more qualities that would make somebody a good candidate or maybe not a good candidate beyond that?
Well, if you have symptoms of menopause, bad hot flashes, night sweats, vaginal dryness, then hormone replacement therapy is a good option to have. But if you have, say, family history of breast cancer, if you yourself have breast cancer or a history of blood clots, high blood pressure, diabetes, all those medical conditions, then hormone replacement is not a good option for you.
We talked about how it can certainly help, and we do have video on the screen now. What are some of the side effects, though? What do women have to consider when really figuring out if this is a good fit for them?
The side effects, well, especially the symptoms of menopause, will be the hot flashes, night sweats, depression, weight gain, crying spells, vaginal dryness, or painful sex. Those will be the symptoms for which you may consider.
Do the risk factors, depend on maybe how much of a dose you take or how long you're taking it? Does that make it go up and increase?
The duration of the treatment is really important because the studies have shown that if a woman has been on a hormone replacement more than 10 years or so, it does increase the risk of breast cancer a little bit. So if you are getting hormone replacement, you should have the lowest amount of dosage and the least amount of time.
Can you explain why maybe some doctors don't recommend this type of therapy?
Right, so just like Dr. Hardas mentioned, if you have any family history or personal history or anything that makes you high risk of developing breast cancer, then we would try to shy away from these types of hormonal replacements because some breast cancers are responsive to hormones, and by taking those extra supplements, you could be in a way kind of feeding those cancer cells and progressing your disease. So that would be,
You two work with these women firsthand. Can you kind of speak to, from a personal part of you, what it's like to see this treatment work for someone and the joy that comes from that? How rewarding is it?
Oh my God, it's amazing. I had people literally cry saying how much better they feel after starting the treatment if they had bad symptoms.
Yeah, and I imagine it's just as emotional when you see a loved one get a treatment that works. Have you interacted with a daughter or a sister or a spouse in that way?
Well, a really lot of close friends, I would say. I have had that experience with.
How rewarding. Are there any other treatment options that get recommended?
Absolutely. People who cannot take hormones or will not take hormones as well have got a lot of options, and they really should not suffer in silence. There are over-the-counter medications or supplements you can use. Depends on your symptom. It's a symptomatic treatment. So if you have hot flashes, night sweats, there are over-the-counter herbs like black cohosh, estrogen supplements. There are some SSRIs or antidepressants which can be given for that. For vaginal dryness, you can use over-the-counter lubricants with silicone or water-based. Or there are treatments like radio frequency or laser treatment of the vagina, which will help with the vaginal rejuvenation and help with the painful sex and dryness.
Thank you so much. I know this is a topic a lot of people think about, but you don't hear it discussed often, and so I hope some people at home are appreciative, and we really can't thank you enough for the insight you bring, both of you.
Thank you.